Hi, this is Dr. Schoor again. I'm going to talk a little bit today about erectile dysfunction. Erectile dysfunction, from a treatment perspective, is actually a very straightforward thing to treat. We only have a number of things in our armamentarium uh, to offer. Those include medical therapies like Viagra, Cialis, Levitra, injection therapy like Trimix or Bimix or Caverject. Uh, we have the vacuum erection device to treat, and we have intraurethral suppositories like Muse. And that's it from a medical perspective. We have some surgical options to treat the condition, like the penile prosthesis or the internal penile pump. And now there's some evidence that endovascular stenting can work. But really, the more important thing when it comes to erectile dysfunction in men is what causes it. Uh, because you certainly don't need me to prescribe you Viagra or Cialis or Levitra. You can go to the internet for that. But so I want you to think about erectile dysfunction in terms of a broader class of disease called endothelial disease. The endothelium is a lining. It's actually the lining of every artery in the body. The endothelium is a living, breathing structure, and it can get sick, just like every other part of the body. And the endothelium, well, when it gets sick, it forms plaques uh, and blockages. So you may have heard of coronary artery disease or blockage of the arteries of the heart. Well, the blood vessels that supply the penis and the bladder and the prostate are actually smaller than the arteries of the heart. They're in the 2 to 3 millimeter diameter size compared to 4 millimeters for the arteries of the heart. So these arteries will become symptomatically blocked about 10 years before the arteries of the heart. So what this means is that if you're in your 40s or late 30s and you're experiencing sexual dysfunction or sexual dysfunction in combination with voiding dysfunction, this actually might be a sign that you have endothelial disease of your pelvic vasculature. Uh, and what it means more importantly, or as importantly, is that you have about a 10-year period until you develop symptomatic blockages in the heart. So what I would recommend is if you are experiencing these conditions, go see your doctor. There's some simple blood tests that can be run, physical exam, and so on and so forth. And these can help you more than you know in about 10 years. Any questions, please feel free to contact me.